Hypertension, hypertension, hypertension. Hypertension is the leading risk factors in developing the cardiovascular problems. Whether we are talking about angina, heart attack, heart failure, or we're talking about a stroke, or having another condition where there are chances of having a tear in the big blood vessel, which we call dissection. All of these diseases are linked to hypertension, and as we've discussed in our previous podcast, the chances of having heart failure, which is attributed to hypertension, is nearly 50%. So that is the reason that we have to manage high blood pressure. Now, what hypertension basically means, the pressure of your blood against your blood vessels. The normal blood pressure that we try to make sure or try to control is around 130 to 140 by 80 to 90. We try to control the blood pressure within this limit. Now, how we do diagnose high blood pressure, and we do diagnose the high blood pressure through a blood pressure monitor. You must have seen this blood pressure monitor in the clinic, in pharmacies, or when you're visiting your GP. The problem diagnosing a blood pressure in a clinic setup is uncertain because of this thing called white collar blood pressure. So usually what we see when a patient comes in a clinic or in hospital, the blood pressure usually goes up naturally because they're stressed or anxious. So that is the reason the doctors or the health system has come up with another system. There are two different systems which are to identify high blood pressure. One is called ambulatory blood pressure. So basically a blood pressure monitor is attached to your arm for 24 hours. And the other way of diagnosing or finding out the high blood pressure is through a home blood pressure monitor. So what we try to do is we try to teach patients to monitor their blood pressure for 7 days, to have morning and evening readings when they are completely comfortable. And then we try to calculate an average to find out the exact blood pressure. So once the blood pressure is identified to be high, we try to categorize it in 3 different categories. There are certain high blood pressure issues with certain bodily problems that require same-day admission. So if someone is having high blood pressure and having issues, for example, a chest pain, or having issues like a blurry vision, or a high blood pressure with some blood in urine. So these are red flags with the high blood pressure that needs to be seen on same day. What if the blood pressures come to a stage 2 or stage 1 hypertension, which is a blood pressure which is high but lesser than 180 systolic or 110 diastolic? We try to start on medication based on their ethnic group and also based on their age. There are different types of blood pressure medications that are preferred according to the background medical problems, age of the patient, and the ethnic group. For example, patients from black origin usually are preferred to have a medication called calcium channel blocker, and the most common one available is called amlodipine. For people who are diabetic or who are lesser than 55 years old or have got to have some sort of kidney problems, they are preferred to have a medication called ACE inhibitors, and the most common one available are ramipril. We do understand that these medications comes with some side effects as well, and there is a proper way of monitoring these medications. Usually when you attend your doctor to starting this medication, they have a follow-up plan of doing certain blood tests to make sure that your body is well tolerating the medications. Now, once we found out the high blood pressure, we try to do and calculate other risks as well, which the most common risk factor is called Q risk. And Q risk basically is an idea or an estimate of finding out chances of having a cardiovascular event, which is chances of having a heart attack or a stroke in a group of 100 people in the next 10 years. And based on the probability, we do offer another medications which we call statin. When we try to manage the high blood pressure, we try to discuss the lifestyle modifications as well. Whether it is about smoking, managing diabetes, managing weight, all are very crucial. And what we try to make sure we are touching everything when we're discussing high blood pressure. So if you've got a high blood pressure, or if you're concerned of a high blood pressure, please make an appointment with your GP, and they can assess your blood pressure. And if they think that you're at risk of having high blood pressure, we can discuss how we can manage or monitor your blood pressure at home and then make a plan afterward. I'll come with another video with another interesting topic about heart health. Till then, take care.